Most of us define health through a narrow, binary lens. If your scans are clear, your blood work is normal, and you aren't currently fighting a pathogen, we assume you are healthy. International frameworks established a different standard. The Universal Declaration of Human Rights classifies health as a fundamental legal right. This classification imposes a strict, binding obligation on the state to ensure its citizens can attain it. The World Health Organization defines health as a state of complete physical, mental, and social well-being. This definition recognizes these three domains as a single, integrated requirement for human life. Under this standard, simply building hospitals or treating infections is insufficient. The outdated biomedical model treated the human body as a machine and the doctor as a mechanic fixing acute malfunctions, ignoring the environment where that machine exists. Because nations like the Philippines have codified this right into their supreme law, the state has a mandatory obligation to address the structural factors of social well-being. Addressing the conditions of human existence is a constitutional requirement, not a political choice. Social well-being is defined by the systemic conditions in which people are born, grow, work, and age. A person who is biologically free of disease but experiences chronic homelessness or unemployment fails to meet the legal criteria for health. Poverty acts as a direct health inhibitor. It restricts access to nutritious food, safe water, and preventative care, creating a cycle of vulnerability that no amount of clinical medicine can break on its own. This creates a complex governance challenge. The state is illegally mandated to provide social well-being, but managing and measuring that state requires entirely new tools of governance. To manage well-being, policymakers divide the concept into two primary, measurable psychological domains. The first domain is hedonic well-being, tracking the subjective experience of happiness and positive psychological states over distress. The second is eudaimonic well-being, focusing on optimal functioning, tracking how an individual actualizes their potential and finds a clear sense of purpose. Fulfilling the right to health requires governments to design the social architecture that allows citizens to cultivate both hedonic satisfaction and eudaimonic growth. Historically, nations have evaluated their success almost exclusively through gross domestic product. This metric is blind to the social determinants of health, calculating economic output while ignoring the quality of lives producing that wealth. Consequently, a nation's GDP can rise while citizens suffer from collapsing safety nets and declining eudaimonic well-being. Relying on GDP allows governments to claim success while they are simultaneously failing their legal obligation to protect population health. To deliver on the right to health, modern policymakers must integrate multidimensional well-being directly into national budgets. This shift is already underway. The OECD Better Life Index represents the first major international effort to benchmark national success beyond sheer economic accumulation. The index measures 11 distinct dimensions of life, including housing, civic engagement, and work-life balance. It allows policymakers to see exactly where a population is flourishing and where its social well-being is under threat. In 2019, New Zealand institutionalized this by designing its entire national budget around well-being. They evaluate policy based on the management of human, social, and natural capital, rather than a simple fiscal surplus. These frameworks transform well-being from a soft psychological ideal into a hard, measurable benchmark for the allocation of state resources. Wales has taken this movement to its legislative extreme through the Well-Being of Future Generations Act. This law acts as a legal guardian for unborn citizens, mandating that current policies cannot compromise the well-being of future populations. The divergence in global health outcomes is the result of governance capability and deliberate political choice. Health is a product of political order. True health is only achieved when physical vitality, mental resilience, and social security coexist. Replacing the biological fallacy with multidimensional well-being allows governments to fulfill their ultimate legal obligation, protecting the human story beneath the biological symptom.